Good morning, everyone. Welcome to this week's Fralin Biomedical Research Institute Pioneers in Biomedical Research Seminar. I just want to always put in a plug for the next seminar. We have a little break coming in after this week for a couple weeks, and then the next seminar in the series will be on April the 2nd. And that speaker will be Dr. Farah Lubin from the University of Alabama at Birmingham. And Dr. Lubin will be talking about the epigenetic basis of memory formation and dysregulation in memory disorders. So I hope to see everybody then. I also want to remind people that next week, as part of the International Brain Awareness Week, sponsored by the Dana Brain Alliance and the Society for Neuroscience, we'll be having Brain School running it here from the Fralin Biomedical Research Institute on Tuesday and Thursday evenings at 5:30. So without any more delay, I would like to introduce our own Dr. Warren Bickel, who will introduce today's speaker, Dr. Adam Leventhal. Warren?
Thank you, Mike. It's a real pleasure to introduce Dr. Adam Leventhal. So I've known of and known Adam for several years, and watching his career trajectory reminds me of like you're watching a sporting event and you see an athlete do a remarkable move. You say, "Who is that guy?" And then you keep on watching additional games. You say, "Wow, he always making cool moves." And he moves from "Who is that guy?" to "Watch, it's Adam. He's going to make some really cool moves in this game." So it's a real pleasure to introduce him. He's done remarkable work. He's a professor in preventive medicine and psychology at the Keck School of Medicine, USC, and USC Norris Comprehensive Center. He graduated from University of California, Santa Barbara, and completed clinical psychology graduate studies at the University of Houston. He also attended Brown University Medical School for his clinical psychology internship and postdoctoral training. He's the founding director of the USC Institute for Addiction Science and USC Health, Emotion, and Addiction, which supports transdisciplinary collaborative addiction research and education. He's received over $40 million in NIH funding. Dr. Leventhal's laboratory focuses on adolescent and young adult tobacco, cannabis, and opioid use, addiction among populations with mental illness, suffering from socioeconomic disadvantage, and who may come from different minority backgrounds. He also examines the development of medications to treat nicotine dependence, and uses that to inform public policies regulating tobacco and other addictive consumer products. He's also interested in cancer and cardiovascular disease prevention. And without further ado, let me introduce Adam Leventhal.
Thank you. That's the warmest round of applause I've ever gotten given a Zoom talk. So anyway, I'm really glad to be here. Let me do my screen share. And thank you, Warren, for the kind introduction, and Mike for inviting me to this. Let's see here, desktop. So with Warren's sports analogy, hopefully I'm not like my favorite football team, the Chargers, because they always end up blowing it in the end. So anyway, so really glad to be here. The title of my talk is Effect of Contemporary Societal Exposures on Youth Behavioral Health. And then, I added the quotes around effect today because I'm going to be talking about observational research, not any experimental research. So I should use the term effect lightly. All right, so today I'm gonna provide some information to indicate that behavioral health is generally getting worse amongst youth and young adults. I'm also gonna talk about some high prevalence, timely societal exposures, which is the key piece of this talk, and some prior findings about how those exposures are associated with some adverse behavioral health outcomes. When I say behavioral health, I mean substance use and other mental health problems. And so I had this talk, that I've been developing over the past few years. And then of course, 2020 happened and the pandemic. So now I've updated it to provide some initial findings in terms of what's happening to young adults during the pandemic. And then I'll conclude with some final thoughts. All right, well, I think it's fairly clear that on average, emotional distress is increasing in US teens. So here's some data amongst high school students, percentage who are reporting feeling sad and hopeless. And then if you also look at suicidal thoughts, behaviors, and plans, you see the same trend going upwards. It's not looking good. So let's look at another outcome. Well, here, this is cannabis use. So past year cannabis use is increasing in young adults. So, you know, this figure, the lines look pretty flat, but actually, if you kind of scrutinize it from a public health perspective, if you look at college students, a 9% increase in the prevalence of past year cannabis use, we're talking millions of people. And you also see it in non-college young adults. And adolescents, you know, it's kind of iffy about whether cannabis use prevalence is changing. It depends on the metric. Here is evidence that diagnosed ADHD in youth is increasing, right? So you can see over this period in this study that there's a fairly sharp increase in the prevalence of ADHD. Now, of course, you know, there's also the issue of increasing capturing and increasing diagnosis as the cause. And but nonetheless, you look at everything, there's some reasons to be concerned. Others, which I'm not going to talk about, and you know, near and dear to my heart is nicotine vaping, because I've been studying it a lot, but that's been going up for the most part. But cigarette smoking has been going down. And then other drug use, illicit drugs, it's kind of up and down, but generally nothing to be severely concerned about. So I just wanted to acknowledge the overall context in terms of youth. So what's the cause of this, right? So, you know, what I'll be talking about is there could be increases in risk factor exposure. So obviously it's not genetic, right? So probably something in the environment bin. It could be reporting bias, but some of the metrics like suicide fatalities have been going up. So that suggests that not all of this is due to greater capturing or reporting. And then maybe you all in the audience have some other ideas that I haven't thought of. So for something to really have a large public health impact, you have to consider a couple of things. One, if there's a risk factor, we need to know what is the prevalence of exposure or being positive on the risk factor. And then you have to multiply that times the health effects of the exposure. And then that cross product basically equals the population health impact, or the number of people's lives who will be changed by the exposure, right? And so there are a couple ways to get to increases in overall population level trends. There could be some new risk factors that are happening that are fairly low prevalence, but are really have strong effects. And if there is, you know, I don't really know about too many of them, but instead, what I'm going to talk about are another potential explanation is that there are what I'm calling societal exposures. When I say society, these are things that affect a significant portion of society amongst youth and young adults, just because our culture is changing and things are happening in the world, not just to small groups. So these I define as relevant to the current milieu. They're going to be sizable prevalence, right? And in some cases, you know, we talk about the COVID pandemic, the prevalence of exposure to the change in society to the pandemic obviously is 100%, right? The adverse health effects could be subtle, but because they have a high prevalence rate, then the population health impact could be significant. And then the other thing is they're not going to be invariably harmful to all, which kind of goes with number 3. So just if we show a change in odds of 20% or 50%, well, you know, having that risk factor obviously doesn't mean you're destined to have an adverse outcome. It's just a probability increase. So all the data I'll be reporting today are from one project, so the Happiness and Health Project. So this is a study we started in 2013, about 3,400 ninth graders across 10 schools in Los Angeles. And so those of you who know LA, this map will make sense. Those of you who don't, well, this is just the middle of the sprawl of our city. And I guess the key thing to think about here in terms of how those markers are spread across the city, those are the 10 schools that we partnered with, is that it covers kind of a diverse and heterogeneous region. And we had good retention, at least in high school. Retention dropped off a little bit post high school by 25, 30%. So here, this is our sample in terms of their, I think, 10th grade characteristics. So this was a study that started in 9th grade, and we resurveyed them every 6 months throughout high school, and then have done, I guess we're on our 3rd post-high school follow-up. So you can see very racially and ethnically heterogeneous. And same thing with parental education, which is a marker of socioeconomic status in youth, and same with eligible for free or reduced lunch. And then, this is just the age when they were, I think, in the end of 10th grade, right? Yeah. So let's talk about exposure 1, digital media. We're on it right now. We're using it. You're using it right now. Okay, so when I was growing up in the 80s, this is like what digital media was. Oh, Nintendo. Game Boy, it was so fun. It was so awesome. And then, if you wanted to watch a video, you went to Blockbuster or Sam Goody, right? And you wanted music. But now, okay, you text in, you don't talk on the phone if you're a youth. And you take selfies and you post it on Instagram. And then, like, even if see how young she is, she's probably the same age as my daughter, 9, and my daughter's probably on the iPad right now. The content is a little bit more racy. And then, we don't go to the video store. We just click Netflix. So you can have whatever you want whenever you want it. And so there's no absence of stimulation. So one of the things about this new media is obviously the content I was just alluding to might be a little bit more risque, I guess. There might be more violence. There might be more sex. But also marketing is riddled amongst every app that you connect with. And then, in terms of social influences too, you're just basically connected to nearly anything and everything. And one of the things that I think is really important, but I think has been underlooked when we talk about new media, is the potential neurobehavioral effects, right? So you can have anything you want, highly stimulating, all right? So I don't think we can appreciate what the threshold of stimulation and high performance of the media that we're experiencing are in today's day and age. You'd have to go back in time and compare. We always have our attention divided. We're always on. We got our push button notifications. And, of course, as I mentioned, some explicit and stressful content. So if you are a teen and your brain is developing, but your psychological world is saturated by this, could it potentially interfere with the development of potential neural pathways, or even not even thinking neurally, but just thinking about behavioral skills that promote the ability to delay gratification, sustain attention, all these important functions. There we go. So, so we did a study, simple study. A lot of the studies, actually all of the studies you'll see, they're simple correlational studies. Is the independent variable associated with the dependent variable, with a few little things put in there. So we wanted to know if it was associated with ADHD symptoms in youth. So what we did was, you're looking at the key results. So before you start staring at them, the design was that I think at the baseline, which is I think maybe in 10th grade, we took everybody out who surpassed a threshold for significant ADHD symptoms on the survey, and all the outcomes are survey based. And then, and at that time, we asked them how many different digital media activities they use at a high frequency rate, like nearly all the time, right? And then the outcome, we had multiple waves of outcome, and we looked average across those waves. What is the prevalence who had new occurrence, I should say, of ADHD symptoms? They crossed the threshold. And so you can see here, this is basic descriptive statistics, that there is somewhat of a linear trajectory or a linear association. As the number of different media activities goes up, the risk of ADHD goes up. And so the activities were, what was novel about this study was, we weren't asking about TV. We were asking about if they're going on Netflix, if they're texting, if they're posting pictures on Instagram, are they streaming music on apps? And then a lot of the studies I'll be talking about, we just throw a lot of covariates in the model. I think the reason is because I think it's better to be conservative, and even if you're partialing out potentially relevant causal variants, it's better to account for it. So anyway, the point here is, and I don't want you to stare at all the numbers, right? But there's a lot of covariates, okay? But then no matter what, it didn't change. So this was the odds. So with each individual, each higher number of digital media activities that the teens were doing at a high frequency rate, that was associated with 10% greater odds of having ADHD symptoms at the time points averaged across the follow-ups. So this is a subtle effect, and it becomes more noticeable, I think, when you compare the low and high ends. So, and then think about COVID. We're spending all our days on screens. You're on a screen right now. So I'll come back to that. Let's talk about cannabis. This is new and different. So if the old cannabis, you smoked joints, you smoked flower cannabis in a pipe, maybe you smoke it in a bong. Well, it's different now. So as I said, this is still around, but now with legalization, and really the important thing is commercialization. You have edibles. Of course, blunts, they've been around, but they're increasingly popular because there's new cigar companies that are actually advertising, the blunts along with their product indirectly. Dabs, so those are cannabis concentrates. And so those are brand new. Those did not exist, I would imagine, I think 10 years ago. So the most concentrated THC form ever that you can use. And that's how you dab. It's kind of like a vaporization type of a thing. Imagine the way I would characterize it is if someone wanted to smoke heroin, sometimes they would put like heroin on a piece of foil and light it. And then the foil will get hot and then it would vaporize and really sometimes combust. It's the same way, but it's a very much sophisticated. You put the dab on the dab rig. And then vaping, right? Both dry bud and liquids. So what is the prevalence of use and polyuse across the spectrum of cannabis products? We asked this question. And one of the things that intrigued us is we do a lot of tobacco research, and this term poly-tobacco product use has become prominent, right? The idea that, especially amongst young people, co-using, not at the same time, but like in the past 30 days, a regular combustible cigarette, and then later that day, vaping an e-cigarette, and then the next day, smoking a small cigar, that's fairly common. But now with the diversity of the cannabis product marketplace, it's possible that the same thing's happening with cannabis in terms of polyuse. And so here, simple descriptive study, we took every users of cannabis in 10th grade. And so that was about, I think, a third of the sample. And you can see here, there was a lot of poly use. So I think 2/3 of the sample used who had used cannabis had used 2 or more different types of products. So I like this figure just because you can see that there's a lot of overlapping circles. And then you can see here another take-home message is that 24% had smoked, used edibles, and vape cannabis in their life of the users. So about a fourth. So as I was alluding to earlier when we were talking about dabs and the concentrates, might some of these products be more addictive? Well, we looked at that. And then, so here, to define the study design, what we did was we wanted to look to see whether we could predict progression in the frequency of cannabis use amongst teens who at 11th grade, they were not regular users. They reported either using 1 or 2 days, or they didn't use at all. And what we wanted to see was, as you might expect, if you compare teens who use 1 or 2 days versus those who don't use at all, and you convert that to an odds ratio, of course, there will be a difference in odds in terms of who will be continuing to use later, which is the persistence estimate. And then of course, they'll be using more, right? So we were expecting that these are gonna be a bunch of significant associations. It wasn't surprising at all, right? And so what you're looking at here is, these are odds ratios of that contrast. So I'm calling experimental versus no use at baseline of a respective product, combustible here. And then what are the odds that they're using that product at follow-up over a 6 months follow-up? And you can see, of course, 6 times greater odds, right? People who use cannabis use cannabis. What we were interested in though was, well, did it matter in terms of the product they were using? And you can see here, blunts, interestingly enough, and when we put in these multivariable models, the odds of persistence was still significant, but not as high. And combustibles and concentrates were kind of on the higher end. And then this is the rate ratio. So this can be interpreted right here, is that if you were experimental versus non-experimental combustible cannabis users, so just the regular cannabis flower, you were the number of days you were using cannabis at follow-up was 2.5 times larger, right? So 2.5 versus 1 days would be an example. And then here, what kind of jumps off the screen is the concentrates. And so that suggested to us that it was some indirect evidence that concentrates might be more likely to recruit persistence and progression to higher levels. So, a 9 rate ratio. And one thing just to note is that the absolute risk is not super high because concentrates, the prevalence are not as high as the other products. Something to keep an eye on. All right, so a little bit more foreboding. There's not much to do during the pandemic, so and you can deliver cannabis, or you can get it on delivery due to digital media. All right, so societal discrimination. This will be something that maybe some of you probably hadn't heard of. Probably most of you, because we made it up. Okay, all right, so let's go back. So in spring 2016, there's a presidential campaign, and there was a lot of highly publicized media in relation to major societal events that showed that there were some people in our country and some policies that were discriminatory against racial and ethnic minorities and other groups, religious minorities. So that was a major change. And what we were interested in here is we happened to have the study going on, and we had pre versus post Trump election. And in the spring, when we took this follow-up, that's when the travel ban and all those other things, the building of the wall, those were all brand new. So we were interested in looking to see, well, in addition to people who are amongst a minoritized group, you know, them and the majority groups, were they stressed out and thinking that overall, is society heading in a direction where our population is becoming more discriminatory? So we looked at that pre-Trump election during the campaign. And then we also looked to see behavioral health outcomes after the Trump campaign. And we also looked to see whether they're from 2016 to 2017 in terms of their you know, their perceptions of increasing discrimination in society. So we made up this measure, 3 items. Like, are you concerned and worried or stressed? 3 separate items. They would rate them about increasing hostility and discrimination of people because of, as you can see, all these various categories. And then so then you get a continuous scale, the level of kind of concern, worry, and stress about this issue happening in society. So if you look here at the results, you can see that there were modest increases. This is just the people who said they were very or extremely concerned in terms of the response options. And so, you know, modest increases. If I had more time, I'd show you this by race and all sorts of interesting things. But anyway, there were some modest increases. But what was kind of more interesting was that if you look to see, there was variation. Some people were more concerned, some people were less concerned. So it was on a continuum. And if you convert that into a standard deviation units, what we found was that if in 2016, each increase in your level of concern over increasing discrimination in society, each point standard deviation higher on the distribution was associated with 77% more cigarette use days by 2017. So that was the largest association. And then here, just to show you that the effects estimates were smaller, but statistically significant. And then, you know, we control for a lot of various things in these studies. So these are all adjusted. So modest. And then another thing that was interesting is we looked to see whether race and ethnicity was a moderator, if there's an interaction between race and ethnicity and concern over societal discrimination and that association with cigarette use at follow-up. We looked at the other ones too, but this is the most interesting finding that I wanted to share with you. So basically amongst the white students, yeah, there was variation, but it didn't seem to matter as much in terms of your cigarette use. If you're Hispanic, it mattered, right? If you were Black, it really mattered. So the potency, if you will, if this effect is causal of this concern was stronger amongst Black students. And so, which kind of makes sense because, you know, they have more to lose if society is turning more discriminatory in their perception. So that was then, and this is now. Now I'm going to go into what's happening in 2020. So we resurveyed the sample a couple of times. The second time we resurveyed the sample after they graduated, and we followed up people who did and did not graduate, but they were the class of 2017. So we've been following them 2013 to 2017. We measured them again in 2019 and then again here in 2020. And so now I'm going to talk about some findings with this group. Yeah. So no news to you, right? COVID-19 happened. So this was a big issue. I mean, it still is, but you know, we have vaccines, so this is hopefully becoming less concerning. But you know, a lot of young adults in this young adult population, there was a lot of anecdotal evidence that they were not following social distancing guidelines. So here's an article about that. They were partying. And of course, Black Lives Matter movement just advanced because we had the deaths of, 3 major Black people at the hands of police. major stories about this. And of course, there have been countless others. But I think, you know, the resonance in terms of, again, the societal exposure has really, really markedly spread. So it wasn't just Black people and some other groups who are worrying about this anymore. Now many more people are worrying. Also, you know, in the state of California, cannabis was an essential business, so they stayed open. And then I'm not going to present data today, but you know, all of the college students, and of course high school students too, but now they're young adults in our cohort, you know, they are not enjoying Zoom education, just like we're probably not enjoying our Zoom lab meetings as much, right? So anyway, so all right, kind of a little bit related to the previous study. We wanted to know whether political party affiliation was associated with failure to social distance. And one of the things that I think that led us to do this study is that, like, yeah, like people say, oh, this is an obvious question, you're going to get an obvious result, right? But remember, we are in a very blue county, in a blue state in Los Angeles. And secondly, young adults, historically, right, have not really had strong ties between their political values and their health behaviors. And so while we knew that there were some national things happening, we didn't know in an urban center what's happening. So let me show you the results, whether you know, political party affiliation was associated with the outcome. So I guess the key thing here is, this is mainly cross-sectional. I'll explain a little bit. But we asked them, like, in the past 2 weeks, how often have you practiced social distancing? And so what we did was we compared people who, these were the safe people who were the reference group that said usually or always. And then there's other people who said sometimes, rarely, 6 feet away. And then we looked at 4 different, what would be labeled high-risk activities. So here's some nice, simple bar graphs. What you're looking at, so Democrats, Independents, and Republicans, self-identified, cross-sectional. And we also had people who, I guess they said they didn't want to say or they didn't know, but the results are the same as the Democrats and Independents. So you can see here, fairly large difference in terms of those who report that they're basically not complying with social distance recommendations to those in the Republican group in comparison to Democrats and the others. Visiting a restaurant, bar, or club. And so remember, this is May and August, so this was like a pretty heavy time for COVID in Los Angeles. I think it started to like wane a little bit later in the summer. And then host a party with 10 people, attend a party with 10 people, visit an indoor public venue like a mall. So you can see a fairly substantial trend. So that was the main point of the paper, right? But there are some other findings that I'm gonna nerd out with you a little bit on because I think this audience will appreciate it. So we had 22 covariates in our usual kind of thing we do, right? So these are the different types of, these are all odds ratios, right? And so I think what I did for simplicity is I'm showing you the odds ratios for Republican versus not. Sorry if I'm not remembering exactly. No, standard deviation units. Okay, yeah. So this is, I think this is, sorry, this is for, yeah, Republican versus Democrat maybe. So anyway, so these are, oh yeah, it doesn't matter actually for these because we're looking at the covariates. Duh. All right, so survey month. So here, this is just kind of proof of concept because like restrictions were loosened in Los Angeles and other parts of the country. There were some of our young adults had moved outside of Los Angeles and a few outside of California. So kind of you'd expect this, you know, greater odds of doing something when the place is open. Substance use, right? So it was interesting to us that substance use was associated with these failure to social distance outcomes, and then also this is for some of the folks who are like Warren and collaborate with Warren, is we found that age 14 impulsivity was associated with modest increases, and you know. These are significant, but modest in terms of engaging these high-risk activities. And then also delinquencies, it's like conduct problems. And then we have these other, there's a bunch of variables in the model. This is the only other thing that I think that's of notable is that if they think they're in good health, then they don't need to social distance, right? So I thought that was cool. I mean, not good, but interesting. Not cool in that. Okay, so remember I was talking about cannabis and having nothing to do, and MedMen. That's a big cannabis dispensary that's used in Southern California, and they have a app and online delivery service. So in this study, it's kind of semi-longitudinal, you'll see, and then we looked to see whether they had reported ordering cannabis online or on delivery during the pandemic. And then one of the key things we were interested in was whether those teens, those young adults who had ordered cannabis versus those who hadn't, right? And they're all cannabis users in this study, but did they show a greater increase, right? With the idea that maybe the fact that ordering cannabis was easy might have made them want to increase, if you interpret this as a causal effect, made them want to increase their cannabis use. So that was one of the key things we were looking at. So when we looked at the descriptives, so this is during the pandemic. So this is kind of May through August, or May through November. And then this is before, this is in 2020. And then this was a 2019 assessment. So both young adults, right? They did, a lot of them did turn 21, which is the legal age for purchasing cannabis in this interval. But we're not really interested in the overall increases, the comparison, right? So you can see here, the people who went to the physical dispensary because they were open, that increased, but so did online or delivery. So there's a percent saying who used this way. And of course, buying from a person didn't really matter. And then free shared with me, a little bit less of them did that, right? So this is just descriptive. Now let's go to online. Let's look at the online delivery, and let's really kind of scrutinize this. So when you compare these two groups, before the pandemic, this is the number of days that they used out of the past 30 cannabis. You can see that there was a difference, right? 2.7 versus 1.3 mean days. So they're already high risk anyway. They're on a pathway. And then you look during the pandemic, 3.7 to 1.8, right? So you still see a difference, but the differences diverge. And this is kind of the key thing, is the change score. The increase of 0.4 for those who weren't ordering, and the increase of 1.0 for those who were ordering during the pandemic. So we're working on this. This is just descriptive results. And I think there's a number of other potential explanations besides the causal, but just talking here about the interesting pieces. And then lastly, right, so, we actually had been measuring concerns about police brutality in our cohort for a while. After the Ferguson incident, a couple of years back, we started getting interested in this. And so we just kept the measure in. And then, of course, what happened, you all know. So I'm going to show you it's a similar measure in terms of concern. Are they concerned, worried, or stressed? Creating a continuum of kind of concern levels about police brutality. Oh, here it is, right? Police brutality or unfair treatment of members in your community by law enforcement. So 1 to 5, and then we take the mean. Okay, so this is just cross-sectional in terms of the design, right? Because what we do is when we do a a survey wave, we send out batches randomly to like subsets of the participants over like a 2-month interval, right? And then, you know, they have as long as they want to complete the survey, right? Some of them complete it right away. Some of them, we got to bug them and bug them and bug them. This is all online at this point, right? So it's like, it's not really randomly assigned. So there's some confounding, but anyway, now you kind of understand the context. So this is an opportunistic study, just like many of the studies we did. So this is when we started the wave, right? And we did our first batch. And then George Floyd was killed. And then boom, you can look at this mean brutality score, police brutality score. And then it kind of dips down, right? Which is these things with societal exposures, right? People really care, and then maybe they stop caring. Although who knows, it may not be causal. There could be other confounds. And then one of the other things that was interesting to kind of tie this together, right, is that the people who were using social media infrequently, let me see, I'm going to try and cover up. Okay. Or not at all, right? Versus those who were kind of like the norm or regular. They were less concerned, worried, or stressed about police brutality than the people who were using it moderately or frequently, averaged across the whole entire period. So we didn't have the ability to look at interactions with time because it just didn't have enough data. But you know, you think about like these societal exposures. How is it happening? And why are they increasingly relevant? Because when a major event happens and is newsworthy, right? It's just, we're inundated. You wake up, you get your push button notification from Apple News, and it tells you another thing and another thing and another thing. So, you know, one hypothesis might be that they just got more stimulus exposure, right, to this issue and all the things that were happening. You know, another, of course, explanation is that they just were people who care more about social issues, and they happen to be social media users. But, you know, covariates in the model and all that stuff. So just like everything I'm reporting, take it with a grain of salt. All right, so conclusions. So these societal exposures, they have subtle, usually, sometimes robust, but subtle increases in odds of behavioral health problems at an association level. So one thing to think about, right, is these exposures are widespread and they're spreading. So cannabis commercialization, I think that's one of the things to think about. Legalization is a separate issue, but that's not really the problem. It's the commercialization and the insufficient regulation. And anytime something gets commercialized, as we know about the alcohol and tobacco industry, the sugar industry, the meat industry, right? These industries are going to come up with ways to develop a greater diversity of products that will reach a wider audience. They'll come up with something that someone likes, whether it's something that's fat-free but has a lot of sugar in it, in terms of the sugar industry, or a Virginia Slim to get women to smoke in the tobacco industry. So anyway, that's something to think about. And then in terms of commercialization, digital media, right? I mean, there's a big industry behind that, right? And so it's just going to become more powerful and accessible, you know, and it's just going to happen. So we need to think about this. And then unfortunately, you know, there's going to be more social injustices. So we hope that will reduce, but this is just going to continue. I wish I could say that that issue will resolve, but being a realist, it will take time. And so the one thing to think about, though, is there could be some counterposing effects for some of the exposures. So, you know, these effects are subtle and they're average across people who are versus not exposed or level. But, you know, in some cases, digital media is good, right? This is just an example. You could say the same thing potentially about some of the other exposures, depending on your stance, right? You know, it's good for people to be concerned about, you know, the social injustices. It is, right? Even if it's stressful, it's good. It's good for people to be, or it could be good for some people who find cannabis therapeutic. I don't know. It's, there's not a ton of medical evidence, scientific evidence to support that, but just, want to also show both sides of the coin. But in terms of media, it's a little bit more clear, right? In terms of accessing social networks that you may otherwise not be able to access, that's good, right? So especially if you're in a rural place and, there maybe is no one like you, you're a member of the LGBT community, to join a network could be very, very preventive in terms of mental distress for certain populations. And that's just one example, right? Of course, all the other wonderful educational tools before we were forced to use them were great to have. And then, so we got COVID and the pandemic. So public health education, you need to consider the population. And I'm not saying one thing's right or wrong, right? But from public health education perspectives, you don't need to have value judgments on people in terms of their health behavior, but you should take into account where they come from if you want to change it, right? And then, I had mentioned the tobacco users, the alcohol users were less likely to social distance. Are we going to see more disparities that are behaviorally mediated, right? So some people in addiction science have been considering that. Do we need some cannabis restrictions? I've already alluded to that. So if it keeps on getting easier to get cannabis and to get other addictive, health damaging products, then, put two and two together, you might see increases. And then, as I was saying earlier, you might want to capitalize on young adults' concern, but, also think about the stress that people might be experiencing about social justice issues. And then the future, I wish I could give you our vaccine readiness data. We have some, but it's not ready just to report yet because we're in the middle of our wave 11. We need to figure out more what is protective. So I talked a lot about kind of risk. And of course, the absence of risk is protective, but there are other kind of protective factors. And then, in terms of what we're going to do in the future, same thing. We're just going to let society tell us. We're going to keep on hopefully assessing cohorts. We have 2 new youth cohorts that we're following that are 9th graders and 10th graders now. And so when we decide what's going to go into our next survey wave in terms of the self-report measures, we're just going to keep our eyes and our ears and our minds open. So thank you. With that, I'll acknowledge my collaborators, a lot of various people contributed to the work, and of course our funding from the NIH and the California Related Disease Research Program. And I forgot to I probably should have said this at the beginning, but there's no disclosure. So with that, thank you. I'm happy to take questions if there's time.
Beautiful. Adam, we have several questions. If I'm going to take the privilege first, do you have any speculation about when life approximates something normal, what some of those trends that were troubling might look like?
You mean in terms of prevalence, you're saying, Warren, of these behavioral health issues?
Yes.
I mean, just guesses, just like you, right? But I mean, we're already seeing increases in opioid-related deaths, so we know that's happening. There's been some cross-sectional reports done by the CDC that just asking people, are you more stressed? Are you using more drugs than you used to? And the answer is yes. So I would be very, very surprised if we didn't come out of this much worse. People are going to be growing up with parents who died of COVID or have serious health issues related to COVID and might be disabled. So, I hope not, but I wouldn't be surprised if the data suggests that they are. And, what we need to be thinking about is what are the various factors that are driving this? We can't just say oh, well, because of the pandemic, everybody's, worse. Yeah, sure. Right. But can you unpack that? Right. We can't just freeze the pandemic. So let's figure out what's mediating what's happening. Good question, though.
Thank you. Alex DeFeliciano asks, for the media exposure study, were there any measures that could speak to directionality or causality? Kids with tendencies towards ADD could seek out more types of media or consuming media that could then lead to those symptoms.
Right. You might have been a reviewer on that paper, right? So for sure. So, I mean, so one way we did is we took out people who had significant ADHD symptoms at baseline. So in terms of design, but nonetheless could have been reverse causation. We control for, then we said, oh, well, if you control for subclinical ADHD syndrome, what happens? Still have it. So it's not like having like 3 symptoms versus 2 symptoms, but still below the threshold matter. But then, you know, yes, the other direction has been reported in the literature, not like a whole bunch. And then we did a sensitivity analysis where we looked at the other direction, and you find, you know, how I was showing is like the effects were subtle, right? Going from the direction of media to ADHD, the other direction, they're not statistically significant. But you know, like they're not like orders of magnitude smaller than, but you know, yeah, one was significant, one was not. I can say that in terms of the association going the way I showed you, significantly different from 0, but the other way didn't. But I think, yeah, it's probably a reciprocal process, right? Where, you know, chicken and egg thing, and they feed each other, just like mental health and substance use.
Beautiful, thank you. That was William Adams asked the same question, so I won't address that. But Anthony Lamancha wanted to know about other extreme sports or other extreme behaviors that may be related and something that could influence or determine attitudes towards cannabis use.
Yeah, I'm reading it now. Determine attitudes for cannabis. Yeah. Oh, that's interesting. So we did, I mean, not extreme sports, right? Which is an interesting marker, something that maybe we would consider, right? But yeah, we did. So, you know, in that social media, or sorry, in that social distancing study, like I was showing, is we did control for self-reported impulsivity, personality-related traits, and also these externalizing behaviors, like, you know, getting into fights, skipping school. So, you know, those kind of get at a little bit risk-taking. Sometimes, yeah, we control for sensation seeking, right? So like a personality trait to seek out more desirable and pleasurable experiences. So I think that, like, I think that it is true that it is a key determinant of attitudes, right? And people's behaviors, no matter what the context is in terms of cannabis use, whatever's happening, social distancing, you know, exposure to media, like related to Alex's question. So yes, right. And so the question is, like, what's the relative importance of those, and how do you target them? And but I think our research suggests that over and above those factors, some of these kind of environmental exposures seem to matter, at least a little bit. But that's a great question. Thank you, Anthony.
Beautiful. Diane, if you have a question, please type it in. So just a little bit of data that I was aware of that may support some of the findings that you suggest, Adam, and I'll be interested in your thoughts about it. So there's an old paper by Warner in Archives of General Psychiatry, when it was Archives of General Psychiatry, and it was the epidemiological catchment assessment. And in that, they looked at different birth cohorts, and among individuals who use substances, what was the likelihood that they would go on to become drug dependent? Mm-hmm. What they showed was the later you were born in the 20th century, the more likely you were to become drug dependent, with the biggest change in the 50s and the 60s relative to prior times. And certainly,
you're talking about Warren. What's different about this is the transition from ever use to becoming dependent. That was the denominator everybody had used once.
That's right. And so I think they were trying to equate for use during that time frame. Mm-hmm. And so, do you think is that sort of analysis possible? And would you be able to look at that with your data sets?
Yeah, since so we have multiple cohorts now from the same region, right? So we could do something like that, but our interval will be shorter, right? But a lot's happened,
Absolutely.
So yeah, so being in ninth grade, like during the beginning of the pandemic versus being 21. So it's definitely something we could do. The other thing is that the Monitoring the Future study, they always follow up all 12th graders and enroll them and follow them up. So in terms of nationally representative, probably the best way,
Yes.
although all study has strengths and weaknesses, and they're not going to have the same types of unique exposure and survey measures that we do, right? Because they're surveillance, but that's another thing to consider. But that would be interesting, right? If it's something we haven't looked at, but if there's increasing transition that's an interesting question.
Beautiful. Diana, Keith asks, I know you measured alcohol use generally, but did you collect any data on increasing alcohol use during the pandemic? About this cohort, wants to know whether alcohol use increased similarly to marijuana.
Yeah, thank you, Diana, for the question. Yes, is one of the things I had to sadly omit from this talk. So yes, it increased. It's also confounded by age in this cohort. But then we asked the people whether, some of them became 21, right? Pre versus post pandemic. But then we asked them whether they were drinking to cope with the pandemic. And then, that was correlated with greater escalation using a similar design to that what I was showing, the pseudo longitudinal for the delivery. So yeah, we submitted for publication. It was rejected. So it's under review at the next place. So if you get asked to review it, please value it. But yeah, I think so. And I think that's one of the big things at the population level. We have some data that's under review, like in the whole American population, that not to go on too much of a tangent, but if you look at the overall population level means and prevalences, like there's subtle increases. But what really is happening is you see a lot of divergence. Some people who are reducing their drinking and some people who are increasing, right? So like if you like to drink with your friends and go to the bar and then kind of drinking loses its appeal, well then, there might be some other things, right? It's a good determinant to like move into recovery. But then a lot of us are bored. A lot of us are, stressed. And so I think that's going to be the story, is that there's going to be certain subpopulations that have gotten a lot worse or a fair amount worse, and then other people who got better. A great question.
Beautiful. Well, Adam, thank you very much for your presentation. Very interesting results and this good conversation. Thank you very much. And we'll say our deep appreciations. Mike, did you want to?
Thanks, Adam. That was really fascinating. And it looks like you still have power. It's 12 o'clock, I think. So.
I have one more minute, but yeah, hopefully it'll stay on.
Good. It was great. Thank you very much.